right, great. So I'm Jason Goldwater. I realize that this is just after lunch. Everybody's blood sugar is presumably low. I will try to be as entertaining as humanly possible. I thank Gary for that introduction. I have no disclosures other than I really, really like PowerPoint, which you're all about to see in just a few minutes. All right. Okay, so I start off, I have been fortunate that I was the project director along with Helen on the development of a measure framework, or a guide really, on how to develop quality metrics around telehealth. And we finished this project with the Health Resources and Services Administration as the primary sponsor in early September of this year. And the project really has taken off and gotten an awful lot of attention, which is grateful to all of us that worked on it and to everyone, I think, that is really working in the telehealth space. And so I've been very fortunate to be able to deliver a talk similar to this in a number of areas. And I always start off with this. One, because I really like the graphic, and two, I really like the quote, which is medicine. And by the way, a disclaimer, I am not a doctor. I don't play one on TV. I have no clinical training whatsoever. So if I say anything clinical, I am making it all up. So medicine is a science of understanding and an art of probability. And I think that really plays well into sort of telehealth in a way, because telehealth really is medicine. It is not anything different. It is a form of clinical care delivery. Many people will think it is something brand new or something magical or something mystical. So sometimes I start off with this presentation with a big picture of a unicorn. And then I have to break people's hearts by telling them that unicorns are not real, which really disappoints a lot of people for some strange reason. And I tell them this because I say telehealth's not a unicorn. Right? Dennis, we said this a lot on our panel. Telehealth is not some magical, mystical thing. It is a form of care delivery, and it's really understanding care through the modalities and also understanding the data that is provided in order to make the best decisions possible. So, why did we then sort of create, I told you I really, really like PowerPoint. So I'll be happy to give tutorials after this is over with. All right, so there are some great benefits to telehealth which really explain why a framework like this is needed to understand sort of the regulatory challenges and how to measure telehealth effectively to be able to not necessarily overcome those challenges, but to understand what telehealth does well and conversely what it does not, to be able to understand what regulatory changes such as reimbursement need to be made, to understand sort of the financial impact of telehealth, which is information that is extremely difficult to get. A measure framework and the development of measures, as Helen knows well and said earlier this morning, drives accountability. It really makes sure that telehealth is accountable and gives an idea of where it is effective. Does it actually increase access to care? Does it prove timeliness to care? Is it cost effective? Are you able to do care coordination through various telehealth modalities? And my belief really is that eventually if you get to a point where you're able to develop a core set of metrics to effectively evaluate where telehealth may be successful and may be effective, then that is how you get to acceptance, which I think was Mark's point, which is telehealth's been around for a long, long time. We actually had somebody on our panel that said the first telehealth encounter was in the 1800s. Right, right. Oh, that's not true. I'm sorry. I'm kidding. Which was a phone call between a patient and a provider. That was the first example of telehealth. And you know, you can take that as you wish, but it does lead to a greater form of acceptance when you're able to actually measure it effectively. So, why did we then sort of create the framework? What was sort of the genesis of the project? It was one, to sort of understand its principles, to inform its future use, because if you have a core set of measures that you can use to effectively and objectively assess telehealth, regardless of modality, then it sort of informs that future use. It provides an objective and independent way for assessment, and it's a method for putting it all together. The elements that make telehealth, it's not, and Helen said this earlier, and I'm not just repeating everything that Helen said, but it's not, really I'm not. It's not just video conferencing. I mean, that's long been sort of the thought, which is telehealth is real-time video interaction, and we are way, way beyond that now. It is not just real-time video, it is also secure messaging, it is store and forward, both synchronous and asynchronous, it's remote monitoring, and the real explosion has come in the digital health, mobile health area, in which there are roughly now 500,000 applications that are dedicated to healthcare. And in fact, most of the wearable technologies, including the Apple Watch, which I have on, serves a lot of functions. I mean, yes, I can get the latest CNN updates, which is great, but people primarily, and even Apple acknowledges this, use the Apple Watch as a health device. And that's really where they've been putting a lot of emphasis on. So people look at this slide and they ask, why is there a paper airplane and a coffee cup in this? There's no significant meaning. I just did it to sort of mess with people's heads because I thought, oh, that'll get people talking. All right, so what were the steps and processes that we did when we went ahead to create the framework? I know this is cool. When I did this slide, I actually rehearsed it in front of my wife, Yael Harris. Some of you may know who she is. And she looked at this slide and said, in our 18 years of marriage, this is the greatest thing you've ever done in your life. And I said, you realize that we do have 2 children? And she sort of ignored the fact because I can make a rocket ship move on PowerPoint. Helen, this is what I do in my office when my door's closed. Right, okay, so we did an environmental scan of all of the literature, not all of it. We really focused on a 10-year period from 2006 until 2016, which is the time we were doing the scan. And we weighed the articles, evaluated them, and out of the roughly 600 articles that we came up with a cohort of studies that we used. We formed a committee, which NQF is known for. Dennis was, we had the great pleasure of having Dennis serve on our committee, along with a lot of people that actually ran telehealth programs in a variety of states, including Alaska, New Mexico, Arizona, as well as those that had substantial expertise in telehealth, but also substantial expertise with measure development. We identified appropriate outcome and process measures that did not necessarily have to be modified, that could be affiliated and used to telehealth without necessarily saying that telehealth was the mode of delivery. We reviewed MACRA to see what measures would be used that could identify with telehealth. We created measure concepts where we found that there were gaps, significant gaps that were existing, particularly in the areas of access, timeliness, and so forth. We then developed the framework that took all of that information that we had and actually then created a structure by which people could then look and see, I want to create measures around access of care, great. I want to create measures around access of care for patients. Here are the concepts that the committee said are the measures that are really needed. And then after that, we got feedback through a public comment process and we fine-tuned it. So developing the measure framework is really understanding what needs to be measured. So what is a measurement framework? I mean, we get asked that question a lot. I get asked that question a lot. There's a lot of different elements. Each one is incredibly important. A framework is a conceptual model, a guide, really. There are measures that don't exist. Here's a guide on how those measures can be created. We take all that information and we group them into high-level domains, those areas which the committee considered the most important to evaluate in telehealth, and Helen mentioned this morning, which were access to care, financial cost and impact, experience, and effectiveness. Then we take those domains and we break them out into even smaller subdomains. So we have access to care. What do we mean by that? Access to care for patients, access to care for providers, access for the care team, access to information. And then from that, we then develop very specific measure concepts. Note, a measure concept is not a measure. NQF cannot create measures. That would take our status away as the Geneva of the measure development world, where we have to be a neutral entity to review measures and endorse them. We subsequently can't create them, but we can create, through our committee, concepts, which is an idea for a measure that has a description of what the concept is and a planned target. So the domains and subdomains that we came up with, again, were access to care for patient, family, care team, and information, experience, and notice that we talked about experience, not satisfaction, because satisfaction is sort of a nebulous word that could have various meanings, and I always equate that with airlines. So I could take a flight that, leaves on time, arrives on time, it's the worst experience of my life. But by, standardized metrics, it should be a great experience. Then I could take a plane ride that doesn't leave on time, arrives a little late, but all of the flight attendants are singing and dancing and giving out free drinks, and it's the greatest experience ever. By a pair of standardized metrics, that would not necessarily work. So we focused on experience. We did financial impact and cost for patient, for family, the healthcare team, the health system, and the payer, as well as society. And then effectiveness, we looked at it from a system, a clinical, an operational, and a technical standpoint. The priorities areas of measurement. There are a lot of areas to measure, but the committee really decided that there were 6 areas that we really needed to focus on. Care coordination, patient empowerment, what the added value of telehealth was, actionable information, which they consider to be the most important. And what do we mean by that? Actionable information is, does the telehealth modality provide information to the physician so that they know what to do next, so they understand what has to be done immediately thereafter? Timeliness, and timeliness is providing timely care as opposed to no care whatsoever. And then travel. What's the reduction in travel cost as well? So what measures, when we did the review of measures, which ones did we come up with? By clinical area, we found a few that we really thought would apply to telehealth regardless of modality. You didn't need to use the GT modifier to say it was a telehealth mode. You could just take the outcome of how the service was provided, independent of modality, and evaluate it against the measure. We found measures in chronic disease, in care coordination, in rehabilitation, and in mental and behavioral health. And what's not on here, because I ran out of room and the head would only cover so much space, is we did find 2 measures in dermatology as well. So accepting the framework, right? This is the hard part. So we built this great framework, I'm not being biased, and we have a guide on developing measures. We understand where the gaps are. We understand the pathway to develop the measures. So how do we use the framework not only to develop measures to assess telehealth, but also in a way to make telehealth acceptable and to make it widely used? So here we go, right? There's the unicorn. It's not real. Sorry. Just because Starbucks made a drink out of it doesn't give it any more justification. It's not a real entity. Telehealth is not a unicorn. Despite its many benefits and advantages, it's not a magical solution for healthcare. It is a form of care delivery, straight and forward. And so you have to measure and evaluate it as that, as a means of care delivery. There are different ways of using telehealth, whether it's in the ER, whether it's ICU, whether it's neurology, whether it's mental and behavioral health, or whether it's ICU. It's covered in far more domains with far different modalities than ever before, which really justifies and necessitates the need for measurement. Because the only way you're going to get to accountability and eventually to acceptance is be able to show objective and independent metrics that say, this is what it can do, and this is where it's deficient. I know Helen and I do a lot of speaking on measurement, and the one thing that we always say is, measurement is not always to tell you what you do well. It's to say what you don't do well either. And there is never a technology solution that will solve everything. There is always technology that will facilitate the solution to a problem, but how well and how effective you need to be able to objectively measure. So how do we move the pathway working from increased access to standardized care? Technology evolves. You don't want to limit innovation whatsoever. You want innovation to continue to thrive. The more innovation, the better, because eventually you come to better solutions. There does have to be, we hope, through the framework, a core set of standards to evaluate those modalities. And there really should be a way of certifying, to some extent, these digital health applications to think that they meet at least a minimum threshold of functionality and usability and literacy to the patient. We have to say that it's utility. Measure the utility, the benefit to the provider and the patient. Its usability, the ease of the modalities of care for both the patient and the provider, and the way that that information is understood. Is that information accurate? Diagnostic accuracy is a major issue. Does telehealth provide the necessary information and data that is captured through the care team that provides accurate information so the provider knows what to do next? And then eventually you get to a pathway of accountability, and when you get to be able to make telehealth accountable and you are able to see that it can do what it's supposed to do and where it may be deficient, that is how you move to overall acceptance. Leveraging the framework for acceptance is a very valuable part of the triple aim. You really have to look at things like quality and the modalities. You have to develop measures that are delineated in the framework. The telehealth, if you do that, if we're able to develop measures using this as a guide, it'll focus on what telehealth can provide and its impact on quality and its impact on how it can improve health for patients and for populations. How does it intersect with measurement? It becomes valuable and useful when you align policy initiatives, when you really align things like MACRA or MIPS with telehealth, because then it becomes an integrated part of value-based care. When you align measures, so again, you don't want, as Mark was putting it, micro-measuring. You want measures that are core to what telehealth can do, and also on outcomes that don't have to be changed because of the modality of the way the care is being delivered. And then you have to be able to drive outcomes. Can the use of telehealth in areas that are not necessarily just located in rural areas? Telehealth for the longest time was focused in rural areas, and it still is, it still needs to be, but it is just as focused now, if not more so in certain areas, in urban areas. So in Dallas, for example, where I'm from originally, yes, I'm a Cowboys fan, sorry, that Dallas Children's Hospital of Dallas just worked with 200 schools in the Dallas Independent School District to implement mental health and behavioral health video conferencing facilities with American Well to provide that information, to provide those facilities for students. So how do we put it together? The impact of telehealth on quality measurement, make sure that it's comprehensive, make sure again that it really focuses on the patient, make sure the infrastructure is sustainable, again, looking at things that measures that matter, getting to a core set of measures, not necessarily just every measure, but focusing on those areas the committee deemed were important and building measures that really evaluate that, being innovative, streamlining so that, again, you're focused on telehealth as a whole, not just focused on modality, but telehealth as a means of delivery, and then making sure that it's both feasible and that it's flexible, because as innovation continues to evolve, the framework has to evolve with it. Thank you very much.